All right, well, good morning. Good morning. Thank you all for coming out early in the morning for some of you, I bet. But we're going to talk about peripheral arterial disease today. It's affecting more and more people, just as we hear about heart disease and diabetes and obesity affecting Americans across the country. September is PAD Awareness Month, so I think that we coordinated this quite well to do this topic during this month. Here are some of the statistics. About 8 to 12 million people have PAD. By the age of 70, 20% of the population has PAD. This number is very important. 50 to 75% of patients with PAD do not experience symptoms. And we'll talk about symptoms here in a minute. The number one thing I want you to pay close attention to is that patients with PAD have a 6 to 7 times higher risk of developing a heart attack or stroke. So again, no previous history of having a heart attack or a stroke, and when someone is diagnosed with PAD, research shows 6 to 7 times higher risk. Some other research shows 4 times higher risk. The main message is that if you develop PAD, you have a higher chance of having a heart attack or a stroke. It's the same process that occurs in the leg arteries with the buildup, the hardening of the arteries, that buildup of plaque and cholesterol that we hear about affecting our heart arteries. PAD, the definition is a common circulation condition in which the arteries in the legs become narrowed or clogged, slowing or stopping normal blood flow. And then sometimes the arms can be affected as well because we have arteries in our arms. Causes, again, of PAD can be the cholesterol buildup, the hardening of the arteries that we hear frequently about, and it also can be a development of a blood clot that can produce the pain in the legs. Blocked artery in the legs is a powerful, again, a warning sign of heart disease and stroke that can develop. So this shows you, if we were to slice the artery in half, what the blockages can look like. The yellow here signifies the plaque or the cholesterol, and the red in the middle signifies the blood clot. And then this would be what a healthy artery looks like. Dr. Campbell, one of our cardiologists at Mercy, tells us that about the age of 10 to 12, we start laying down plaque inside our arteries. So early on in life. And then when we add other risk factors like smoking, lack of exercise, maybe having problems controlling blood pressure and cholesterol, then you're more likely to then have more problems with blockages building up inside the artery. Intermittent claudication, a very fancy term, but what it means is it's the most common symptom of PAD. It's painful cramping in the leg or the hip when walking, and then when you sit down after 30 seconds or a minute, then the pain goes away. And this would be on a very routine basis. So every time you get up and walk, at some point, whether it be a block or 2 blocks or 3 blocks, you develop pain. And it makes you want to sit down, and then after you sit down, the pain goes away. These are the other symptoms that we'll walk through. Remember a couple slides previously, about 50 to 75% of people with PAD do not have symptoms. So we're going to talk about symptoms, and then we're also going to talk a lot about looking at your feet, assessing your feet when you take your shoes and socks off. So leg or hip pain during walking that stops at rest. That previous slide, that's what we call intermittent claudication. Numbness and tingling. Let's talk about that for a minute. Do any of you have diabetes? Okay. Well, sometimes with diabetes, you can have numbness and tingling in your legs. That's also defined as peripheral neuropathy. So is it peripheral neuropathy that's developing, that's giving you the numbness and tingling, or is it PAD? So that's a great question to be able to talk to your physician about. I'm hoping that especially all of you that have diabetes, and even I'm hoping that some of you, when you go see your physician on an annual basis, that they have you take your shoes and socks off, and he touches your feet, and he assesses your pulses. Weakness in the legs. Well, weakness in the legs can be a lot of things. It also is a sign of PAD. And what we hear a lot is that people don't talk to their physician about their leg pain. Maybe they view it as it's a sign of old aging, or maybe it's a sign of arthritis, or maybe it's my back pain and now my legs are being affected. So very important to have the conversation with your physician. Burning or aching pain in the feet or toes while resting. Well, this raises another question for me with restless leg syndrome. At rest, primarily at night, people have a lot of problems with restless leg syndrome bothering them. Sore on the leg or foot that will not heal. So very important to pay attention to your feet, especially with winter approaching. It's going to be very important that you protect your feet, that you're wearing socks to keep your feet nice and warm, that you're putting some lotion on your feet so you don't have problems with dry feet and then those dry areas cracking, and then a sore is likely to develop from that. Cold legs or feet. This is an interesting one. A lot of people tell me that their feet are cold. They feel that their feet are cold, but when we actually touch them during our screenings, their feet aren't very cold. So it's kind of amazing how our mind can play tricks on us. Cold legs and feet can be a sign of poor circulation, but it doesn't necessarily mean that there's a blockage in the artery. But again, these are some of the symptoms to look at for PAD. Color changes in the skin of the legs or feet. This is a big one. If any of you have discolorations on your shins, sometimes discolorations can develop because of having problems with varicose veins. And remember, today we're talking about arteries, we're not talking about veins, but a sign of venous insufficiency can have discolorations. Paleness or blueness of the tips of the toes is important. That's not normal. You want the tips of your toes to be nice and pink and warm. And then loss of hair on the legs. Hair is a great sign of blood flow and oxygen. And so if you start to notice that on your shins especially, that you're not producing hair, that can be another sign of poor blood flow and oxygen to your legs and feet. Any questions on those? So who is at risk? These next two slides, I'm sure some of you have seen before, because what I really want you to connect is that PAD and heart disease and stroke all have the same risk factors. So if you're having difficulty with controlling your blood pressure and your cholesterol, it not only increases your risk of heart disease, but it increases your risk of PAD. These three risk factors are what we call non-modifiable, which means I can't control these, nor can you. Every year we get a year older. Family history is something that's given to us, so it's important that you know if PAD or heart disease runs in your family. And then certain races, Hispanics, African Americans have a higher incidence of PAD than Caucasians. So who's at risk? Modifiable. These mean risk factors are risk factors that we can control. And so look at this large list here. So the majority of PAD can be controlled, just like heart disease can be controlled and stroke can be controlled. So high blood pressure. High blood pressure is a risk factor for PAD. High cholesterol. So if any of you take blood pressure medicine or cholesterol medicine, you have a risk factor of PAD. These next two are the most powerful risk factors for PAD. And these two we like to zone in and target and screen patients who currently smoke or currently have diabetes. So keeping your blood sugars in the normal range is very important. We try to work with patients and counsel them with smoking cessation, programs and activities to help them stop smoking. Inactivity is a big one. Remember I said that the most common symptom with PAD is pain in your legs when you walk. Well, if I had pain in my legs when I walk, I probably wouldn't want to walk, correct? So then you would sit, and so I wouldn't have an active lifestyle, and maybe I wouldn't be making the best food choices, so I would start to add on some weight, and then that would affect my blood pressure, and that would affect my cholesterol, and all of those things increases your risk more for PAD. So it's important that we still keep people active even if they have PAD. It's important for them to get up and walk to the point of pain and sit down and rest. and then get back up and keep walking. Some research and medical professionals believe that with walking, you actually push more blood flow and oxygen down to your legs. We all know that walking can help control our numbers. It can help keep our blood pressure in control, and our cholesterol, and our blood sugar, which then also decreases our chances of developing PAD. And then the other one, obesity, so sedentary lifestyle, not having a good weight control, and then the previous history of heart disease or stroke. So if you've had a previous heart attack, and you had risk factors for that, and then that blockage developed, if you don't make lifestyle modifications, then you're more risk to develop another blockage somewhere else in your body. So diagnosis, how do we diagnose PAD? Well, the physical examination is very important. And again, I can't stress enough that when the next time you visit your doctor, I encourage you to automatically take your shoes and socks off and tell him, hey, I want you to look at my feet. I want you to look at the coloring of them. So your coloring from your knees down to your feet should all be the same. And we notice a lot of people have discolorations on their shins that are much different to the coloring on their feet. We want the physician to actually touch your feet. Make sure that your feet and your toes are nice and warm. We want them to look at your toes. These are things that we do in our screenings to make sure your toes are nice and pink and warm. And then you have a pulse. You actually have 2 pulses that we assess. Just like if you were to assess the pulse on your wrist or the pulse up on the side of your neck, that's what the pulse should feel like on the top of your foot. And usually I tell patients, when you get home tonight and you take your shoes and socks off, take your foot and draw an imaginary line down the middle of your foot, and closer to where your foot and your leg meet, take your first 3 fingers and hold some pressure there, and you should be able to feel your pulse. There's also a pulse behind your ankle bone that we assess in our screenings as well. And we want to make sure we can feel your pulses with our fingertips. In conjunction with today's presentation, after I get done speaking, I will sit back at the table, and those that are interested in the October 7th date screening, this is what we're going to do during the screening. It takes about 20 minutes with me. I will do the actual ankle brachial index, but then I will give you a lot of education about your ABI. You will receive results because there's a range of numbers. But how do you perform this? So the first word is ankle. Well, we're going to take ankle pressures. We're going to put the blood pressure cuff around your lower leg, and I'm going to first try to feel with my fingertips your pulses. And then we're going to use a small ultrasound machine, and we're going to listen to with the ultrasound machine to see if we can hear your pulse. And then we will actually take a pressure down in your legs. So it feels awkward a little bit having the blood pressure cuff on your leg because we normally don't routinely have blood pressures taken. It gets tight like it does on your arm, but there should be no pain involved. And then with the brachial, that terminology means arm. And so we're going to take pressures in both of your arms. I don't know if some of you realize that there can be a difference between blood pressures in your right arm to your left arm. And you know, when we normally go to the physician office, we usually just get one arm checked, and that's usually the arm that's closest to the blood pressure cuff on the wall. So it's important to know what both arms are doing as well as legs. And so then when we obtain all 4 of those pressures, we do a calculation. And we want to find that the pressure in your legs match up to the pressure in your arms. Or we find maybe there's just a little bit of a difference. We certainly don't want to find that the pressure in your legs are less than the pressure in your arms. Or on the other extreme, we don't want to find that the pressure in your legs are higher compared to the pressure in your arms. If that is the case, then that's what's called peripheral arterial disease, or PAD. Does that make sense? Have any of you ever had an ABI done on your legs? Okay. So physical examination is very important. The ankle brachial index test is a very good test to have done on your legs if you've never had that. And it's important that we screen patients at risk. So again, patients that have diabetes, or patients who smoke, or patients who've had a previous history of a heart attack or stroke, very important to have the screening test done. So let's say that you have an ABI done and it's abnormal. Then the next step, typically, patients go over and they go to the ultrasound department and they have more of a comprehensive Doppler study or an ultrasound study done on their legs, instead of using just one blood pressure cuff around the leg, they use 3. They put a cuff around your thigh, around your calf, and around your ankle, and they obtain pressures and they obtain volumes. They exercise you on a treadmill, and then when you sit down after exercising, they recheck those numbers again to see if there's a difference, because remember, PAD can affect your legs when you walk. So we want to see after walking, does it induce pain, and what are your pressures like after you get done walking? And then after that, sometimes physicians will order what's called a CTA. It's a CAT scan or a CT scan, but it looks specifically at the arteries in your legs. And sometimes patients can't have a CT, so they'll have what's called an MRI. Some of you may have had an MRI before on your brain, and we can do an MRI angiography or an MRA on your legs. And then if we find that there's a significant blockage in the artery that's really impacting blood flow and oxygen, and you're having symptoms and you've been through some of these previous studies, then we can actually go in and do an angiogram on your leg. And we can use balloons, what's called angioplasty, and we can also use stents, which just are bigger in size because our leg arteries are bigger than our heart arteries, and that's what treatment can be. So treatment options. What I see primarily is lifestyle changes that are important. So getting people to walk. And our research shows that PAD is very important initially to help people get through that phase of pain in more of a supervised, monitored program. At Mercy, we have a Fit for Life program, which is an exercise program that's monitored by staff. And we help you on the treadmill with walk tests, and we make sure your vital signs, we monitor those. And we see over time that you're able to get on and walk farther before symptoms develop. We recommend at least 3 times a day in the rehab program. And again, what over time you'll see is better quality of life, you'll have less pain, and you'll be able to walk farther. There's medications available. Remember, we talked about risk factors. So very important that if your blood pressure is elevated, that we try maybe through a healthy eating plan or an exercise plan. And if that doesn't work, then there's medications available to help control your blood pressure. Same with your cholesterol. Sometimes patients have to be on blood thinners to help decrease the risk of peripheral arterial disease, much like heart disease. And then there are a few medications out on the market to help with the claudication or the pain symptoms in the leg that's specific to PAD. Other treatment options, again, is the balloon angioplasty. Stents can be placed in the leg arteries. Thrombolytic therapy is a therapy that we put a catheter into the artery of the leg, and we drip the medication into that artery, especially if there's a blood clot that's causing decreased oxygen and blood flow. And then sometimes people need vascular surgery, so bypass surgery on their legs, like you hear patients having bypass surgery on their heart. Lifestyle modifications is the biggest one though. Exercise is very important. As Lynn said with her Steps to Health program, I see many familiar faces today, and I see you guys out here walking. Very important to get up and get more steps in the day. The American Heart Association recommends 10,000 steps in a day. Again, speaking to your doctor about starting an exercise program, and these are the key components of an exercise program. The healthy eating habits, again, is very important. Everything in moderation. Trying to make your plate more colorful ensures you that you're getting lots of vitamins and minerals. Knowing your numbers. This is also very important with regards to your risks of PAD. These are the optimal numbers that we try to strive for. Blood pressure, 120/80 or less. Blood glucose, less than 100. Total cholesterol, less than 200. Your HDL cholesterol is your good cholesterol. And I try to remember that the H in HDL stands for high or healthy, and we want that number to be as high as possible. In men, we try to achieve that number greater than 40, and in women, we like to see that number greater than 50. Your LDL cholesterol is your bad cholesterol, and I remember the L to stand for low or lousy. That's my bad cholesterol. And I want to try to keep that number low. We like to see that number less than 100. And if you have diabetes, we try to get that number less than 70. And then triglycerides is another fatty substance that can accumulate in the arteries. And our challenge with that is less than 150. So, kind of in summary, what we talked about today, do you have a family history? And does your doctor, do you have a conversation with your physician about your family history of heart and vascular disease? The risk factors we talked about today. The two most powerful, again, is diabetes and smoking for your risk of PAD. The other risk factor is having a previous history of a heart attack or stroke. Knowing your numbers, so your blood pressure, your cholesterol, your blood glucose. Talking about and remembering what we talked about as far as your legs. Do you have discolorations on your shins or your feet? Are your feet cold? Can you and your physician not feel the pulses on your feet? Do you have symptoms when you walk, and then those symptoms are relieved by rest? Diet and exercise habits, and then again, an annual visit to your physician. These are some of our resources that we have at Mercy. The top one is our vascular program. Remember today we talked about lower extremity PAD. Well, at this program, we operate this program on Tuesday afternoons out at the Mercy Health Plaza, which is right down the street. It's on Council Street next to the Warenberg Theaters. We do 3 screenings. We screen your carotid arteries, which are the 2 arteries on the side of your neck that can have plaque development that can lead to someone having a stroke. So we use an ultrasound machine and we check for a carotid disease. Another form of peripheral artery disease is an abdominal aortic aneurysm, or a AAA. And that can be an aneurysm that develops in your aorta. And so we screen for that, and then we provide PAD screenings. So that's our vascular program. That program requires a physician referral. That program is similar to probably some of the flyers that all of you have received before in your mailbox, that maybe a Lifeline mobile unit's coming to town, or Farm Bureau's hosting a stroke screening. We have our own program at Mercy as well. Fit for Life, this is a supervised exercise program, and in part of that we have a PAD rehab program. So we encourage patients struggling with PAD to participate in the Fit for Life program. The Heart to Heart program, Lynn talked to that in the beginning. That was the certificate that one of her participants in the Steps to Health program won today. That's an hour-long program where we can draw blood, or if you've recently had a cholesterol panel done, you can bring those results in and receive education. Included in that program is a free pedometer or a massage. And then, of course, the walking program in the community and out here at Lindale with our Steps to Health program. And then these, as far as PAD, if some of you like to get on the web, these are some of the resources I used today to develop the presentation. Our mercycare.org website, the American Heart website, and then this website here is the Vascular Disease Foundation. And those, all 3 have great resources on heart disease and peripheral arterial disease. So I talked for a while. Do any of you have questions? Yes?
I received a Health Focus magazine, on health, and it said if you have problems with your leg, you're walking, you should rest it for a while till it heals, and then gradually go back to the walking. Don't push when your leg is very sore. Now, what can you tell us about that?
Yes, one of the... Repeat the question, sure. May I ask your name?
Yes, Sister Lucy.
Sister Lucy's question was, she read in a magazine that when you have leg pain, you should exercise to the point of pain and then sit down and rest and then get up again and start exercising.
No.
Oh, sure. Sorry.
No, it was in a health magazine, and it said if you are walking continuously and you do experience a lot of pain, don't walk until that pain goes away. Rest it for a while, but then gradually go back to your walking, but don't give it up if you can. Okay. Otherwise, you might have to see a doctor.
Okay.
Does that make sense?
It does make sense, and that's a good question. I guess my first thought is, what type of injury are you having that's producing pain? Obviously, if it's a broken bone, certainly you wouldn't want to walk. You'd want that to heal.
It could be arthritis.
It could be arthritis, and we talked about that in the beginning, that how do you know if it's arthritis? Is it possibly your back? Your back can affect your legs and produce leg pain, or is it PAD? So again, number one, speaking to your physician about it, and then kind of going through the list of what could it possibly be, and if there are screening opportunities involved with some of that, then to participate. With PAD, we know you're going to have pain when you walk. We want you to walk till you have anywhere from mild to moderate level of pain. Sit down and rest, allow that pain to go away, and then get back up. What you'll find is that you'll be able to walk further before the pain develops. And again, some believe that by walking, you're going to be able to push more blood flow and oxygen down into those legs. Okay? Thank you. Other questions for me? Yes?
Blood pressure readings.
Blood pressure.
Which arm is higher or lower? How is that?
Okay. A question over here about blood pressure readings. Which arm is higher or lower? That's a great question. All four of our extremities should have equal blood pressures. So if I check the blood pressure in your right arm first and it's 120/80, I should find that same number in your left arm, in your right leg, and your left leg. We've been doing free screenings for PAD at Mercy for about the last 3.5 years. I've never found that. So if your blood pressures in your arms and your legs are close together, let's say your right arm is 120/80 and your left arm is 122/80, not much of a difference. But if I find that you have a 120/80 in your right arm and a 90/70 in your left arm, that's not normal. Something is affecting how your blood flow, then resulting in your blood pressure being affected by that. And we don't know that unless we check both arms and we check your legs. Any other questions? Yes.
Can PAD affect the blood flow to your brain?
Question is, can PAD affect the blood flow to your brain? Yes, and that's what we call carotid arterial disease. So you have arteries in your neck that's called carotids, and those can build up with blockages that can affect blood flow and oxygen to your brain.
So can that cause dizziness then?
It can cause dizziness, yes. Yep. And if you're having dizziness, please talk to your doctor about that right away. Okay.
It's my husband.
Okay.
Yeah, we've been there.
Okay. And yes.
At the high V's, you can check your own blood pressure, and they're all set up for the left arm.
Okay.
So you can make any kind of adjustment on that? Or?
Question is there's a blood pressure machine at Hy-Vee, which you can go and check your blood pressure, but it's just set up for your right arm. Just being able to go and get your blood pressure checked on a routine basis and keeping track of that in a logbook is important, and then showing that to your physician so he can see maybe a trend in how your blood pressure is running is important. I'm sure the machine is just set up to check your right arm, and that's fine. Your left arm. Okay, so it's set up to do your left arm. Next time at your physician office, maybe the nurse has a few extra minutes that you could ask her to check not only whatever arms is closest to the machine, but then your opposite arm to see how that blood pressure is running with both arms.
Do you have any information to hand out?
I do not have any information. Yep. There's some resources. Again, when I'm done, I'll go sit at a table, so if you have specific questions, we can take down some notes if you'd like. Yes.
This is not a question. I'm probably that. Do you care for yourself?
Sure.
This is not a question, but at Walmart you can buy an arm bracelet that will take your blood pressure, and you could use it on both arms. And with my permission of my doctor, I got it, and she said it's same as hers. She said it's wonderful.
Okay.
I imagine you could check your legs too and see how. I never thought of it until today. And then could you tell us what are some of the foods that we could eat to help prevent this, and what foods we ought to stop eating?
So I think kind of a two-part question. Yes, blood pressure machines, if you have one at home, is good. You just want to make sure that it's accurate. And the further away you get from your heart, the less accurate. So sometimes patients will tell me they have a wrist blood pressure cuff. That's going to be less accurate than if you have a brachial or a bicep cuff. So just a little bit of information with that.
But my doctor said mine is accurate.
Okay.
She tested.
Yep, and typically wherever you buy the machine, you can take it back. I know
Yes.
Walgreens sells them, and they're more than happy to help make sure and calibrate your machine to make sure it's accurate. You would be able to check both arms. I'm not sure how accurate checking the pressure in your legs would be, because again, we use the ultrasound machine to really listen to your pulse, but you could certainly try it.
And the foods?
Foods, again, no food is forbidden for anyone. We can have pie. We can have ice cream, we can have French fries, but we can't have it every single day. Everything needs to be in moderation. Just to the other extreme, you wouldn't want to go out and eat a whole bag of oranges. Oranges have natural sugars in them, you know, so everything in moderation. The biggest thing to try to remember, we teach this a lot at our Jocelyn Diabetes Center, is if you picture your dinner plate, if you can divide your dinner plate in half, and the whole half side of your dinner plate be your area for fruits and veggies. So color for vegetables, the more colorful your plate is, the more minerals and vitamins you're getting. And then the other half of your plate, if you were to divide that section in half, so a quarter of your plate would be for your starch, your pasta or your rice or your potatoes, and then the bottom portion be for your protein. There's a lot of good information on our website about nutrition and healthy eating. We have a lot of programs across our community, and then there's resources on the web if you're wanting something specific about diet. But everything, it should be in moderation. You know, we should enjoy the foods and try new foods. You know, it's great we have the farmer's market available to go to that and try new fruits and vegetables. You have a question?
Yeah, if you are attempting to check the blood pressure in your leg, where do you place the cuff?
Okay.
At the ankle or what?
Okay. Her question was, if you're going to attempt to check a blood pressure in your leg, where should you put the cuff? The cuff should be, I'm trying to think how I can demonstrate this. You would want the cuff to be on your lower leg, right above your ankle bone. And you would want to make sure that it's tight and secure, like we secure your blood pressure on your arm. And then again, you'd want to hold your leg nice and straight and still while the blood pressure cuff is increasing.
Should it be elevated too then, like they say to put your arm higher than your heart?
As far as the question is, should your leg be elevated? I would make sure that your leg is, you could sit on your couch and put your leg up and have someone put the blood pressure cuff on. You just want to make sure that the cuff is appropriate in size and it's really secure to your leg to give you an accurate number. Okay? Yes?
Does it make a difference what time of the day you take your blood pressure?
Very good question. Does it make a difference in the day what time you check your blood pressure? It does. In the morning after sleeping all night, your blood pressure normally is low. Let's say you take blood pressure medication in the morning. Usually an hour after that, you'd want to check your blood pressure to see what it's running. You know, being active during the day, your blood pressure would be elevated more so than in the morning. You know, people out here walking will check their blood pressures before and after exercise to see if there's a difference. So exercise sometimes can elevate your blood pressure, and sometimes it actually can lower it. The other thing is important to remember that if you're taking blood pressure medicine, you want to make sure that you are careful about position changes. Going from a lying to a sitting position or sitting to a standing position sometimes can bring about some dizziness symptoms. That's important to share that with your doctor. So yes, blood pressure can change. I could check your blood pressure right now and an hour from now check it and it could be different. It's a good question. Yes?
I go to the VA hospital.
Okay.
A doctor down there told me, don't sit with your legs like this. You know,
Yes.
keep your feet flat on
Yes.
the floor.
Yes. Yeah.
Is that true?
That is true. Question is, he goes down to the VA and his physician encouraged him not to sit and cross his legs. Is that true? That is very true. It can, pardon?
I do it all the time.
Yep.
I see a lot of people do it. I guess I'm not doing it.
Yep, I have a bad habit of that as well. It really can affect your veins, which can lead to varicose veins. And just impacting, you know, the blood flow in the other vessels in the legs. So yes, you should try not to sit and have your legs crossed. And it's hard. We're very, very used to crossing our legs, but it can produce and cause you to have some problems with varicosities or varicose veins on your legs. And sitting for long periods of time is important, that you don't do that, that you get up and walk. You know, sometimes patients will have leg symptoms that develop for a long plane ride or a long travel time in the car. It's important to get out and walk around. Working and sitting at a desk, it's important to get up and move your legs, get that blood flow moving. Any other questions?
Now, even doing this is not the best thing, is it?
No.
This is terrible, of course, but doing this is not good either, is it? I often do this.
Yeah, trying not to cross our legs, and it's hard.
In any form.
Yep.
Thank you.
Yep. All right. Well, very good questions. I am going to go over and sit over by the table that had the beverages, and in conjunction with the presentation today, we're offering screenings on October the 7th. I would like to speak with you individually if you're interested in those. Again, we provide the screenings for free at Mercy, but we want to make sure that people have risk factors for PAD. So I'm hoping from today you learned what the risk factors are for PAD. Do you have those, and are you having problems in your leg when you walk? Thank you all for coming out.